handouts for my own presentation. There's some extra copies on the chairs around here if you didn't get one. So welcome to the session today on global initiatives to engage the faith sector in family planning advocacy, networking, and service delivery. And if the title sounds like a bit of a mouthful, it's because we have a packed presentation for you. We have 4 panelists who are each going to present on the topic of working with the faith sector and Fbos in the area of family planning. I'll begin the panel. My name is Lauren Van Eyck. I am with the Institute for Reproductive Health at Georgetown University. Following me will be Devina Patel, who is on staff at CCIH. And then we have Douglas Huber, who is the co-chair of CCIH's Family Planning Working Group. And then we have Mona Bormet, who is also on staff at CCIH. All right, so my presentation, I'm going to begin by telling you about an initiative that IRH, which is my organization, did with the support of USAID. And we really wanted to look at perceptions and collaboration around family planning between the secular and the faith sector. And so some quick definitions. What I mean by that, the faith sector, is any number of actors who have a stake in global health, but who are also have a faith mandate. So that's Fbos, churches, religious leaders, congregations, a wide variety of actors. And then the secular sector is really NGOs, development organizations, international aid organizations, and donor organizations. So let's just start back a couple decades to really look at when formalized collaborations between the faith and the secular sectors started to take off. A lot of people consider that the Hiv Aids epidemic was the beginning of this, both because this was such a global problem that it really required all hands on deck and a lot of collaboration between different actors, and also because there were different funding streams like PEPFAR, who actually mandated that specific funding go towards Fbos. And this has now developed into different areas of collaboration, including malaria, child survival, hunger, all of which are important international public health goals included in the Millennium Development Goals. So IRH and USAID was really interested in looking at whether or not maternal health, which is MDG 5, could also be an area of collaboration between the faith and the secular sector. And part and parcel to maternal health is universal access to family planning. So IRH conducted a study with the objectives of exploring the role that the faith sector had in improving maternal health through family planning. So we conducted a study that was mostly of in-depth or qualitative interviews, and we did a series of interviews with people both at the global and country level. And these interview respondents were from faith-based organizations. They were religious leaders from secular NGOs, donor organizations, and actually government agencies. And so this is a wide variety of perspectives that we were collecting. So we focused the interviews by looking at specific countries, which included Kenya, Ethiopia, Mali, and Afghanistan. And so as you can see, Afghanistan's a bit of an outlier. That's the one country we did not actually have an interviewer on the ground conducting interviews for obvious reasons. So the data is a little sparse on that country. And then we looked at specifically the traditions of Islam and Christianity with regard to Fbos. So as I said, the data we collected was all qualitative, so what I'm going to do is use quotes to support the themes that we found. In the interest of time, I won't be able to read through all the quotes, but the handouts have them in there, and I encourage you to look back at them because some of them are quite interesting. So the first finding, which is pretty encouraging but also very straightforward, was that family planning is in fact consistent with both Christian and Muslim values. And this second quote really says very succinctly and straightforwardly what a lot of the other respondents communicated, and so I'll read it out loud. It was an in-country Protestant Fbo, says, sometimes there's misconception. The secular world may just present the attitude that the church does not support family planning. This is very misleading because if there's any institution that promotes the family unit, it's the church. And so this really summed up the fact that when family planning is presented as an intervention that supports family health and family well-being, it is very much in line with the faith teachings of both Islam and Christianity. And so our second finding was that Fbos and religious leaders are already engaged in family planning activities on the ground. I won't go into this too much because I think some of the panelists will touch on this a little bit, but this graph just provides a simple demonstration of where some of the activities or the respondents were already engaged. And just to say, IEC stands for Information, Education, and Communication, which was the highest. Thirdly, we found that family planning messages are important. And this also is a rather obvious statement, but it was very clear, reading through all of the different transcripts, that the two simple words, one might think, family planning, really had a lot of baggage. And they meant very different things to different people. And it was so important to clearly articulate just what one meant by the term family planning and the approach that you were coming with it from. And also to recognize that the way one communicates about family planning really reflects underlying values and motivations for why one is engaging in such activities. And so what was clear, though, that there was a lot of common ground around the area of health. And different organizations, like this Protestant NGO, said that because their mandate is to promote health and family planning falls within that, it very much is in line with the activities that they do. To encourage further collaboration between the faith sector and the secular sector around family planning, one should explore increasing or tailoring messages to things like family values, parental responsibility, male involvement, and more of the relational messages, and not just specifically about physical health, but holistic health and well-being. And this is one of the quotes that gave everybody a nice chuckle, and it speaks to the idea of stewardship within the Christian tradition. So in the context of premarital counseling, this Fbos says, they do an exegesis of the Genesis story, where God is telling man to go and fill the earth. It is filling the earth, not filling the house. Because if you're filling the house, it means you have many children in one house and cannot afford to maintain them. But if you're filling the earth, it means you plus other people. It's not solely your duty to fill it. So we encourage family planning. Yeah, this was definitely a good example of just the idea of stewardship, that one needs to care for their resources and their own family, but also that impacts the greater community that you're a part of. And then just to quickly touch on some areas of discord, as we all know that family planning is a sensitive area, and there's a lot of misperceptions and biases out there that say that the faith sector won't engage in this area. And those would be definitely things around abortion, reproductive rights, language around limiting population or limiting family size. This quote from a Muslim FBO is talking about the fact that there are very clear differences, although to some people there might not be. There's a nuance between child spacing and child limiting, and for some Muslims, limiting is actually forbidden in the religion. And for this Protestant FBO, they talk about how often abortion and family planning are conflated and considered synonyms, and this is a widespread misperception that really needs to be addressed. And so the final finding that I'm going to talk about today is the idea that the messenger is important. And so much care does need to be taken in constructing the correct messages that are appropriate for the communities that you're working with. But if it's not delivered by an individual that's trusted by that community, the message will never be internalized. So we have a lot of data about the area of partnerships, around the facilitating factors and the barriers to partnerships in this area, which I don't have time to go into, but the handout does have some quotes that kind of point to where there's areas of overlap and areas that might be outside the possibility of partnerships. But I do just want to point out that this simple Venn diagram, which may seem quite obvious going back to grade school, really did a good job of demonstrating this idea of partnerships. And we found that there was a lot of area of mutual interest and sort of the facilitating factors that would really allow partnerships to move forward in this area that need to be focused on. But it was very important to realize that there are still always going to be areas outside of the middle area on the two sides where partnerships just aren't going to be appropriate and they should not be forced. And this can be for a variety of reasons, whether it's because organizations just have a fundamentally different philosophical mandate, or perhaps the capacity levels are too different, or they have different definitions of the public health problem. But it was very encouraging to see from the data that there were definitely areas of mutual interest that could be pursued. And then just to sum up, so after we collected all of this information, what we did was use the findings to construct an agenda for a technical consultation. The idea for the entire initiative was really to look at the landscape and to get the evidence to support further action in this area, and then to move into dialogue, face-to-face dialogue between all the stakeholders in this area so that they could move to action on the ground. And so in April, we convened a lot of the same interview respondents that we had originally talked to, as well as other stakeholders in this area, to a technical consultation at Georgetown, where we dialogued about these issues, talked about what were the barriers and how we could move forward from here. And we had so much positive feedback that this was just really a safe space where everyone felt their views were respected and they could communicate openly about this. And these were some of the next steps that came out of the consultation, but really I put them here as sort of food for thought for you as the audience, because we really want to encourage discussion from you about these topics. So I would really like to hear sort of your opinions about what some of the issues are in this area that you perceive, and areas that you feel that we can move forward and better collaborate together to improve maternal and child health through increasing universal access to family planning.